Good evening and welcome, everybody. Thank you for being here tonight to learn about Medicaid matters. Um, I'm Kathy Murahashi, and I'm the Public Policy Specialist at the Arc of Washington. And my colleague Sean is here. Sean, do you want to introduce yourself?
Yeah. Hello.
Hello, my name is Sean Latham from Yelm, Washington. I'm the Policy Coordinator for Self Advocates in Leadership, a self advocacy coalition working on legislative advocacy.
Over there.
Thanks, Sean. Well, thank you again for being here. And there's a lot happening. And if some of you have been to previous webinars, this is a slow process, but it feels a little bit overwhelming, I must say. And so we want to give you an update to where things are right now. Let's see, I've got to find where my okay, there it is. My cursor goes. So where we are in the process. So the things that have happened, the first step was the House there was a budget resolution. And the House decided how big was their budget going to be. And that's when they determined how much they were planning on cutting. And that was their determination. And then they had to go to committee and really, and at that, when they first decided the number, we didn't know what those cuts were going to look like or what they would be. And then it goes to committee at the House committee, and they have to work out, well, how are you going to do that? And where are you going to make the cuts? And that's where they have to, so to speak, show their work. So that has happened. They showed what their work was and how much they were going to cut in the House. And then in the dead of night, they debated the bill and passed it. So tried to do it when nobody was really looking. So it's passed the House. The House Senate also had their own bill. There were huge discrepancies between them. But now the House bill has come over to the Senate, and they've got to resolve their differences. And so right now they're really, we're hearing things. They're going to do this, they're going to do that. But again, they're starting to show their work, but there's still a lot of negotiations happening. And it's, we hear things new every day. It's going to do this and that. And, but what you need to know is, again, the House was directed to cut $880 billion from their committee, the Commerce Committee. Most of that had to come out of SNAP and Medicaid. And those were considered historic cuts. And then it has come over to the Senate, and guess what? The Senate said, the House bill said it would be $715 billion in healthcare, and then, cross that out because the Senate's going to do $863.4 billion in healthcare. So that's almost as much as the entire other thing. So in other words, the Senate has higher cuts than the House. I want to change my view here so I can see my notes, and then I've got to find where you guys went. There you are. Okay. Just in case I'm missing. So what does that mean? In general terms, that means they figure from what's called the CBO, the Congressional Budget Office, estimates that will cause about 16 million people to lose their health care, which is, a lot of people. And how that happens is through administrative barriers, and most of that is on the Medicaid side. And then there's also this piece about people that are not on Medicaid but are getting support, premium support through the exchange, through the tax cuts, or not tax cuts, the tax write-offs. That premium supports is going down. So they figure there's a bunch between those two, there's about 16 billion people that would lose, or million people that would lose their health care, which is a staggering amount. So one of the biggest pieces, the way they plan to do this is through work requirements. So, we like to think we're, what the narrative we're hearing is that, work gives dignity and work is good. It's good for people to work, right? But what we know is that most people on Medicaid already are working. Like 60 some odd percent are already working either part-time or full-time. And the ones that are not are usually in school, they're caregivers. They may have a disability. They may be waiting for their disability determination. If you're waiting for Social Security, so they may have a new illness. So there's a lot of reasons why those people may not be working. And again, it's not that much. So what it does is, what I say is, it shuts the front door to Medicaid. To even in going forward from this, it would say that unless you have a job that you're working 80 hours a week, then you can't even apply for Medicaid. Or not a week, a month, excuse me. I want to make sure that that's clear. It's 80 hours a month. So it's about 20 hours a week. So it shuts the front door. So until you have a job, you can't get health care. It also expands the age of people who would need work requirements. Right now, it's up to age 54, and this would extend it all the way to age 64. So it's right up until retirement age. And I'm sure we all know folks that, they at that age that they maybe have no work record, or they've been caregivers, or their kids have moved out, or they may have kind of undiagnosed disabilities that really make it difficult to work. And, or sometimes their bodies have just worn out and they needed to retire early, but they aren't getting disability, right?
You can turn it up.
So that, in other words, it's moved from, we'll change the age to age 64. Oops. Make sure can you make sure you're muted, please? Thank you. The biggest way that they plan to the work requirements really hit people is because it requires more frequent eligibility. So the minimum would be every 6 months. Right now, it's every year. In Washington, you have to your Medicaid eligibility yearly. This would make it every 6 months, and that has a lot of implications. So more paperwork, right? And really what this does is it penalizes people that are working, because not only are you going to have to up every 6 months, if you're working, you're going to have to report your work hours. And how they're going to do that, we don't know. Is it going to be monthly, or can they do it every 6 months? These are things we not. But again, it's another hoop that we'll have to jump through to get Medicaid for folks. Yeah, Eric, you're right. Without Medicaid, caregivers won't get paid. That's really important information. The other things that it does is it penalizes you if you lose your job. So just at the moment, especially if you've been having some difficulties, maybe you can't work anymore and you stop your job, and maybe you've applied for disability, you're waiting, but the moment you need it, you can't get Medicaid. right? Because maybe you need, we know a lot of people that need their medication to be able to work. So, Medicaid is actually helps people to be able to work. It may get you the therapy, it may get you the medication and many other supports that you need to be able to work. So without Medicaid, some people will not be able. So then it will be this trap of not being able to get Medicaid because you're not working, but you can't work without Medicaid. It also, the Senate side also talked about parents of children, under 14, they're considered caregivers, and that they may have an exemption. But now the age is 14, but there's not an exemption for families that have kids with disabilities, right? So we know a lot of our children with disabilities need extra care after school. And it's difficult for families to work when you have kids with disabilities at home. So that's another barrier for us. Right now, the Senate bill says the states have until January 1st, 2027. The date keeps floating around about when they want to implement some of these things. But it really creates barriers to work. So, okay, hold on. I'm going to go to the next slide. The other really big thing that this bill does is it cost shifts to the states. States to set up all the piece around all the monitoring work requirements, more frequent eligibility things. Guess what? That takes staff and infrastructure that we don't have, and states are going to have to build and put into place. So it pushes down the cost to the states. And there's several, it's administrative pieces, just one of those. We'll talk about a couple of the other ways that it pushes down as well. Okay, oops, it didn't move. So the impact in Washington state. So it reduces the federal match in the expansion group of people. So the step back expansion group of people are people that came under, when the ACA came into effect about 2014, they added a bunch of people that could come, that were able to get Medicaid that were not eligible before. Mostly were adults that didn't necessarily have a disability, and it allowed them to enroll in Medicaid. And when that happened, for the first couple of years, the federal match, and that means the federal government paid 100% for several years, and then it reduced it to 90%, and that's where it's been for a number of years. This bill would reduce the federal match to 80% for our state. And that's about $1 billion a year. So that's a huge amount of money that they're going to have to figure out. But again, they would need new staff and infrastructure. That's going to cost a lot of money. Although it's not Medicaid, SNAP is also impacted. SNAP is food, and it's really important there. That has about, $500 million a year in addition. So these things are going to, it trickles down to the state to have to pick up the tab, or that, you have two options. Do you cut or do you raise taxes? This is one of the things that, I don't know how to say this. It's like, it limits how states can raise funds for Medicaid. So this is like a really nerdy thing that, nobody quite understands. The state can tax hospitals and providers and so forth. It's what's called a provider tax, and we do that. But what happens is they take the provider tax, and the federal government says, okay, that counts against the state has to, there have a portion for their match, right? So they say that you can use that for your match. So even though they pay it, it comes back to them because they get the Medicaid match. So what this bill does is it lowers the limit for provider taxes and it rolls it back so that states will not be able to use as much of their money. And this is a big deal. And it's difficult. And they're saying that this would be quite a bit of money, probably another $1 billion, So it's a lot of money. And this is hard because it's hard to explain to people. It's not very sexy. You can't talk about individuals when you talk about provider taxes. It's like, oh, it's just the provider tax. But what it does is it really hurts the state and their ability for their obligation to pay for Medicaid. And the other really not good thing in the Senate bill, the two things that it exempts from the provider tax decrease, nursing homes and ICFs. And ICFs are what we call RHCs here. So they will continue to have the full match. But they won't, for the community will not. So in a sense, it incentivizes congregate settings. And it's not that we don't want them to reduce the tax there, but we want the community should be the same, right? When there's no choices and there's less choices, that these will be the ones that will be incentivized. Let's see. Sorry, my thing is stuck here. But wait, there's more. Again, SNAP. Again, food benefits are essential for people with IDD. About 30% of SNAP beneficiaries are individuals with disabilities and the elderly. So that's a huge, so it's going to be a higher impact. And again, it pushes it down to the states. And what's the bottom line? About between 15 and 32% of people that have Medicaid now would lose their health care, which is about 138,000 people in our state. About 79,000 in Washington would lose food benefits, and approximately 150 would have a partial loss. In other words, their amount would go down. Sorry, I'm having a little trouble with it. There we go. So what happens when all this is pushed down to the states? The state has to figure out what are they going to do. And of course, the two things they can do is either raise money or make cuts. And what happens? The state options to lower costs is, the first thing they could do is to narrow eligibility for DDA, make the entrance to DDA, or it's DDCS now, excuse me, narrower, so that fewer people could be eligible for DDA. The other thing is that we could see, most of our folks with IDD are on home and community-based services. And right now, our state is actually one of the few states that doesn't have huge waiting lists for their IDD waivers. Where you're going to see some hang up probably and some weight is around moving from maybe the basic plus to the core waiver. But we have core waivers available right now. It's not that we don't. Right now, we're seeing there's a little bit of a stall on our IFS program, but we don't see people waiting very long to get on the IFS waiver, the individual and family services. So, take us back to 2008. We had 8,000 people on our waiting list for waivers. And who does that impact most is kids, right? People who are probably on the waiver will continue to be on the waiver, most likely, but it's those kids coming up. I remember the days when people sometimes had to wait 10, 15 or more years to get a waiver. So we didn't see children on waivers, or very few, unless just the very, very high support needs. So, going forward, if our pot for Medicaid shrinks, this is one of the things we'll most likely see. We could also see premiums for care. Other states actually have premiums for people on the waiver for the services they receive, or co-payments. And those could also be for, the Medicaid side, the medical side as well, to begin to see premiums and co-payments. The really big threat is around optional services. So those are things like dental, prescription drugs, and actually our home and community-based services are all optional services that they don't have to provide. So, I think back to the recession and what happened during those years. Those were the first things that got cut, particularly dental and let's see, and some of those other optional services. And pharmacy went down a little bit. They might narrow the range there. The other thing that happens is that they could lower the rates to providers. So they could say, we're not going to cut, let's say employment services, but we're going to cut the rate to the providers. And that could also happen within personal care as well. They could cut the rate to personal care providers. And we already know how difficult it is to find caregivers, right? It's a lot. It's really difficult. So cutting the rate would make it much more difficult. They could also, and they did this during the recession, is change the assessment, the care assessment, to narrow, I'm trying to remember what the formula is right now. I think it's you have to have a certain number of ADLs to qualify for personal care. They could narrow that to say, instead of saying you need to have 3, they could say you needed to have 4. And they could change the assessment so people either got less hours per month, and we saw a lot of that back when, or that people are no longer eligible. And that's scary too. So that's a real threat. And again, eliminating or cutting optional services. Let's see, I have a thing I want to put in the chat box. Let's see if I can pull this off. There's a really interesting article that talks about what happens. Let's see. History repeats itself. There's 2 documents, actually. I'm going to put this. What happened during the recession and the cuts that happened then. And this is for nerdy people that like to read things and want more information. And let's see, history repeats. And this is the actual data from the recession. And you can see Washington State specifically here on this. let's see, I've got to go back now. Got to find my other screen. So you can go there. Oh, here we go. And there we go. So one of the other things I've been hearing and some of the narrative we're hearing that legislators are saying is, or some Congress folks are saying is that, oh, people with disabilities are going to be protected in this act, that they're not going to be impacted. Remember, personal care is no longer a waiver service. So it's still just a general Medicaid service. And again, many of our services are optional. 24% of people with disabilities are on the expansion. So there's a good chunk of people that do have disabilities that are in the expansion. And now they're going to have to prove they have a disability or they're having to wait. And again, it just creates another barrier for folks. And and there's also a group of people that are in the expansion that are people with disabilities who are working, who are making just over the SSI amount, but they still need their Medicaid. And so, they're in that group that could be impacted. So it's not true that our folks are not impacted in some way. And again, the whole issue around being squeezed and watching our services squeezed. Let's see. So what happened last time? So, okay, and this just gets into the weeds a little more. What happened last time? All 50 states during the recession cut services that impacted individuals with IDD. And that's in that article I sent you in the chart. In Washington, was a 5% cut to IDD waiver services. There was an 18% cut to home health, that was personal care, and 8% cuts to state plan services. Again, that's dental and pharmacy. So we know that our folks would be impacted. The other thing we hear is, people are talking about, well, they're just going to take care of waste, fraud, and abuse. One of the things we're talking about that if there really is waste, fraud, and abuse, then if they're finding savings, shouldn't they reinvest it in Medicaid? Because we know we need to fortify Medicaid. And that's not what they're planning on doing. We know that. Andrea, okay, let me stop for a second. Andrea asked, what do you mean personal care is not a waiver service? So Medicaid personal care used to be on our Medicaid waivers. It was, the basic plus core, et cetera. They moved that off and it's its own thing. It's called it's on the community first choice waiver. So it's in a different spot now, which makes it a little more vulnerable. It's not on the HCBS side now. So, yeah. The PowerPoint, and we are recording this, and the PowerPoint will be posted on our website after a few days. Eric, that. Let's see. Okay. So what they found, there's information. If you go to the Kennedy, I'll have to go back and find it. The Kennedy Krieger, not Kennedy, Kaiser Family Foundation. They have super information about a whole bunch of stuff. I'm going to put their link in here, but they have an article about waste, fraud, and abuse. Medicaid actually has some of the lowest level of fraud and abuse. The Medicaid fraud is not widespread. It's not happening at the individual level. If they think about what you hear is all those people that shouldn't be on that's kind of a myth. There's, you know how difficult it is to get on. When there is, it's usually at the not individual provider, but the high level provider, the medical system kind of stuff with, the insurance agencies. That's usually where that is. And it's still pretty lean. Medicaid is one of the leanest and meanest programs for as far as programs that are and how they're run. Let's see. And, we all just want to say this, that people with disabilities are not waste. But because this really impacts people with disabilities, that's got to be our messaging. Okay, let's see. So what is the reality? What we're going to see is emergency rooms visits will increase. Rural hospital, this is a real concern. That piece around the provider tax is huge because rural hospitals particularly serve a large number of people on Medicaid. And if you pull those people out and you're going to have your uncompensated care numbers are going to go through the roof, and they don't have the infrastructure to be able to stay open. They won't be able to afford to stay open. So rural hospitals they're talking about 300 some hospitals across the US will probably close, and people won't have the access to care. Without their health care, they're going to become more sick and more disabled. Without their SNAP, people are going to go hungry. We don't think about is because all that uncompensated care, guess what happens? Those of us who have private insurance, our rates are going to go up because we're going to be paying for people that show up in the emergency room that can't afford to pay. That causes, all right. And they're already the insurance companies are already anticipating that and raising as we speak. It also impacts our workforce. A good number of our people that are care providers are on Medicaid. So, that's a huge piece, and our ability to have the care we need, for people we need to provide care. And also impacts hospitals and all those medical providers. It impacts them as well. It also impacts our economy because healthcare actually stimulates our economy. When people have healthcare, people go to work, medical people go to work. They work and then they go and they spend money on their own personal lives, which stimulates our economy. So it impacts our whole economy when people lose healthcare. Okay, I think, let me check here if there's, I'm sure there's questions. Okay. So why does it make personal care more vulnerable? I think because it's not on the way. So it's more impactful that it would be shrunk, that they would change the algorithms. And I think because it's just a different, I think people that are on the expansion are also community first choice eligible. So there's people on community first choice that could lose their Medicaid. So, and their community first choice. So I think that's why that's difficult, because if they don't have a waiver, then it's going to be difficult to keep their personal care. So your healthcare through SEIU, that's a bargained thing. So our state probably won't be hit, our caregivers won't be hit as hard as some other states that don't offer healthcare to their caregivers. But I think the bigger picture is if caregiving hours are reduced, then a lot of people, you still have to have 80 some odd hours a month to be able to receive the healthcare. And if you go under that, you could lose it. So if they shrink the hours, then we could see people falling off. Those caregivers could fall off the things. Yeah. Okay. Let me see. So I'm going, gonna see if there's other questions, and then I'm gonna let Sean speak. Let me see. I've got to do it so I can see where everybody is.
Copy, but we have Amanda who have a couple, and Anne have a couple.
Okay, Amanda, what's your question? Go ahead and unmute if you would like to ask a question, Amanda.
Kathy, I think it's in the chat.
Is it?
I
Okay.
think so.
Okay, I got to go back. Sorry, it's hard for me to keep up with the chat. Let's see. Amanda. Okay. Oh. So, Amanda, do you have a specific question about the waiver? If you want to ask me later, you can ask me specifically. And then, Anne, you're asking about Section 8 vouchers. We don't have them, but we're trying to get on lists. So we have less information about Section 8, but we do know that there are real threats to Section 8 vouchers and cuts to HUD. We don't have a lot of details right now. They've talked about block granting that with states. I don't know. I'm hearing less from that. I don't know if that's in this bill or if it will come as administrative things later. But I'm hearing a little bit less again. Okay. So, could I explain again the significance of January 1st, 2027? So some of the work requirements would go into effect on that date in the Senate bill. Yeah. So we don't know all the date. Like I said, everything is subject to change at this moment. Yeah. And the likelihood, I don't know. I think this is a very real threat. And I'm going to let Sean, this is probably a good place to have Sean talk about what's next. And then we can talk a little bit more about what you can do and so forth. Okay, Sean?
So I'm adding to this.
This is Sean. So what is next? As Kathy stated, the bill is in the Senate for a vote. The goal is to have this bill voted on before the 4th, and then
And then it will go back to the house. For a final. I might be a bit different way. So I have to come to a compromise. Next.
Yeah, hold on.
this is Sean. Let's now move on to ways you can help and what you, as individuals, can do. First, stay connected by following news, following advocates that are covering issues like Medicaid, and coming to events like this to stay up to date. Second, sign up for the ARC Action Alerts. Both the ARC of Washington and the ARC of the United States push out email and website action alerts to notify you what is happening and what you can do to make a difference. Third, tell your story of how Medicaid impacts you. Your story matters and will make a huge difference when you tell it to lawmakers. It can be as simple as saying, "Hello, representative name, I'm Sean. I use home and community-based Medicaid services to stay in my community and be able to live life to the fullest. Please do not cut Medicaid." Fourth, contact your lawmakers by doing one of the following. Make an appointment on Zoom or in person with your congressional delegation. Attend town halls and speak up. Make a phone call or send an email with them with your story. And finally, you can share information on social media to tell your friends, family members, and community members about what is happening and what they can do to take action. Next slide. As we mentioned, one way to make a difference is to call your congressional delegation by calling 1-866-426-2631. This is the congressional hotline. You will then have to tell them your zip code, and then they will transfer you to your representative's or senator's office. After that, you can share your message and your story with the office staff. Next slide. Our big ask for our congressional leaders is to tell them, no cuts to Medicaid. People with disabilities rely on Medicaid to live their lives. People with disabilities are not waste, we matter, and the services we need matter, they must not be cut. When you do talk with your congressional leaders or their staff, talk about the human cost of these proposed cuts, again by sharing your stories. I think we can all agree cuts cause crisis, and often leads to our country spending more money, not less. If you are speaking up on social media, remember to use hashtags to get your message out to more people. A hashtag is a word or phrase with the # symbol in front, like hashtag cuts cause crisis. Hashtags help connect your post to other posts about the same topic. Please use them. Next slide. And finally, keep your advocacy boots on. Things are constantly changing, it's not over yet. Keep advocating, keep speaking up and speaking out. Next slide. We want to thank you for coming tonight, and we hope that you will pass on this information on to others. If you want to email me, my email is sean@arcwa.org, and if you want to email Kathy, it's kathy@arcwa.org. Now I will turn it back to Kathy for the next part.
I'm going to stop sharing. And I'm sure you all have lots of questions now. And I've seen them in the chat. And, I think you'd ask about the time frame. So they are really pushing hard to have the Senate vote by July 4th. Whether that happens, we don't know. What we do know is those of you who have been advocating, it's actually been working. To take the perspective, if you take a step back, they wanted to have this bill passed in the first 100 days of this administration. And that did not happen because of your advocacy and people pushing back. They know this is a very unpopular bill. They know that. But it's, there are still people that are bound and determined to make it go forward. This is going to be a long summer. We expect, even if they pass, the terrible thing, there's a lot of it still has to go back to the House. And there's a lot of back and forth that's happening between the House and the Senate. Even those that from the same party are disagreeing, about what it should have. Some think it doesn't go far enough, and others, think that this is not a good idea. So a lot has to happen. I think probably we will see. What I heard this morning from the national folks was that we expect maybe the first part of fall to start to maybe see this happen for some, coming closer to votes. They've part of the problem is they've got so much rolled into this bill that it's difficult to just there's just so many things, right? And they, they've got the debt limit and they've got all these things that are in that bill beyond Medicaid. Usually we would just be talking about Medicaid or SNAP, but right now it's all the things. And, there were some things, that were positive that it's called the parliamentarian in the Senate, has to decide. So to vote on this bill in the Senate, it's a reconciliation bill. They have to, it can only cut, the parliamentarian says that it can only touch on budget issues. And there's a bunch of things in this bill that are not necessarily budget issues. And it's the job of the parliamentarian to determine which things are budget issues and which things are just other things that are here, right? And some of the things are getting thrown out. The question is whether they'll just ignore her or not. So that's another issue, whether they just decide, what they're going to do, because they really have, it's going to be a very close vote and it's only going to take a few. So some of the other things you can do is talk to your friends and your family. If you're in Eastern Washington, 2 legislators, Baumgardner and Newhouse, really need to hear from you about how important Medicaid is. They are in our state. So if you have friends and family that live on the East Side, those are the ones you should be connecting with. For those that, some people say, but I've been calling every single day. Good for you. I'm so glad you are. Our congressional delegation is saying, please continue to call. Please continue to email them. They look at those numbers and they're able to say, look, this number of people are calling every day. And, it's saying that they don't want this. So that's really important. If you have folks in other states where they have important leaders, you can call your friends and family in other states and tell them to call their congressional people and tell them how important it is to you. A lot of people they don't know what our lives are like. Our friends and neighbors and family sometimes do not know how important this is. So we need to educate them too and see if you can get them to call as well. I think that's super important. Yeah. Okay. Now I see there's like a whole bunch of calls or questions here. So anyway, how do work requirements impact those who are not able to work due to limitations and disability related issues? Not everyone is able to work for a variety of reasons. Yes. So if your child or your loved one is on an HCBS waiver, the work requirements are not going to impact you. So you can breathe a bit of a sigh of relief. We already have to report our wages to Social Security, right? If they do work, right? But it's the people that are in the expansion. And like I said, there's about 24% of those people with disabilities are in the expansion. They're not on a waiver. And those are the ones that are at risk and that will be impacted by the work requirements. Or people with new diagnoses, while they're waiting to get their Social Security in place. That's a huge piece. Let's see. Oh, good. I'm glad you're encouraged. Let's see. Okay. Let's see. Yes, the phone number on the thing is on the slide was to connect with Congress, that 866 number. That's going to be open probably until they have a final vote. Let's see. Sorry that it jumps around. Okay, sorry. Sorry, the chat box moves around sometimes and I can't find all the questions. Let's see. There's the email that actually goes through. So I would go for the emails to their office. I would go to their website and there's usually a form that you can email. If you haven't signed up for our alerts, action alerts, you can do so. And or go to our website and sign up. We have place there where you can send emails directly to your legislators through that. So maybe Sean can you find our action alert page and put the link in, Sean?
Yes.
Thanks. Oh, thanks, Jody. That's great. Okay, the expansion. So the expansion was, when was it 2012 when they added with the ACA, when that was expanded, part of that was expanding Medicaid for other people, for people. So it used to be Medicaid was only for people that were particularly parents, children, people with disabilities. It wasn't for adults that maybe were able-bodied, but that were poor. So there was a lot of people out there that didn't have access to health care, and they expanded that to allow those people to have health care. And that really helped a lot of people that were particularly low income. And again, a lot of people that were not quite eligible for Social Security disability, but still needed a lot of extra support. People maybe with some mental health issues. So that allowed a lot of people to come on Medicaid at that point in time. And in the beginning, the federal government paid 100% of that. And a couple of years later, and it was intended, it backed it to 90%. This would back it down to 80% of the federal match. So that's a 10% cut from just the expansion. Let's see. Okay, what's the expansion? Sorry. Sorry, I'm just trying to read the chat box. Yeah, I'm on the age, blind, disabled Medicaid insurance. It potentially, well, if probably you're probably okay because it's the disability part, but I'm not sure. I would need to know about that. That is a concern. I think it would be around the that gets you Medicaid while you wait. I think those folks are while you wait for your disability determination. David Laura. Oh, thanks, David. David. Let's see. Sorry. Okay, thanks, Sean. Okay. I'm sorry, it's hard, a little wonky to read the chat box. Okay, did I miss any other questions? Yeah. There are what any insight into what the Senate vote might look like? It's going to be really close. I think you're going to see probably Susan Collins, Murkowski are going to be on the fence. There was today, the senator from, I think, is it North Carolina, Toon? One of them was talking about this and had sent a flyer out to his colleagues talking about how it was going to impact their state. That was a pretty red state. So that was a deal. Missouri, Senator Hawley had put out an article that talked about the concerns around cutting Medicaid. So those are people that are, folks that are on the fence. So it will not take a lot to make them back off. So it'll be very interesting. I would say anywhere where there's a place where, you have a moderate person as a senator, that those would be places to look. Let's see. Okay. Sorry. Okay. Did I miss any of the questions? Sorry, it's really hard. The chat box is moving fast. And I can stop, maybe I want to stop the recording.